And gentlemen, from that beautiful rhythm from the northwest region here is Bamenda Pekin, we have Magasco, Garinho, Madzi, and a host of others on this particular beat. Ladies and gentlemen, we are discussing the hepatitis B birth dose vaccine. We have volunteers, we have resource persons, most of them are medical practitioners. From the community vision group, they are advocating for us to take our babies, to make sure that babies receive the hepatitis B birth dose vaccine at birth. Now we're talking about the number of doses the child is supposed to receive to be totally free from hepatitis B. And for she hope, I would like to come back to you so that you do some clarification, and if not, Elijah might help you on that.
Thank you very much. So we would like to lay emphasis on the fact that there are two different vaccines we are talking about. The hepatitis B adult dosage is different from the hepatitis B birth dose. Okay. And as all parents who have given birth to children know, when a child is born, there are a list of vaccines that the child is supposed to receive. Other vaccines have already been standard and other things are coming into place, one of which is the hepatitis B birth dose that we are emphasizing about, which should be received in the first 24 hours ideally, and it's just the first of 4 dosages, hepatitis B dosages in general. Okay. So a child receives the first hepatitis B birth dose, that is just after birth. Then the next dose of hepatitis B comes as a pentavalent vaccine. That means it comes as pentavalent is 5 with 4 other vaccines all together. So at 6 weeks of birth, that's 1 month, 2 weeks, the child will take the second hepatitis vaccine. At 10 weeks, he will take the third, and then at 14 weeks, he will take the fourth. Okay. But then after that, there are other vaccines that he or she will still have to take. But that's it with the hepatitis B vaccine for.
Thank you for that clarification. So that parents should not go to the hospital and say, we heard over the radio that they are receiving 3 doses. 3 doses are for adults, but for babies, they'll take the first dose and they have 3 other follow-up doses to take, right?
Exactly.
Wow, thank you very much. Now I would like to ask you, Elijah, we'll come back to you. How much does the vaccine cost? This hepatitis B birth dose vaccine, how much does it cost?
Okay, I'll talk about both for adults and for children.
Okay.
But since we are focused mostly on newborns, so I'll start with children first. Actually, given our expanded program on immunization in Cameroon, the hepatitis B birth dose has just been introduced as for free, in which I think so many hospitals around are still to embrace that.
Okay.
And yes, so for children less than 5 years, and of course before you reach 5 years, you must have completed the 4 doses, that's a birth dose plus the 3 other doses, and all of them are actually free.
Okay, for children, for babies.
For babies.
Those 4 doses that we're talking about, they are all free.
Yes.
So if your mother goes to the hospital and they say, Mommy, that one for bed will be free, but if follow up you get for drugs, must until you no drug.
No, the mother should require, like the mother should request, it's actually free.
Okay.
Yes, actually. And for adults, of course is not free for adults, and for adults you have to pay. At first, because for adults, before we give you the vaccine, of course we will screen you for hepatitis B to make sure you don't have. And the screening, initially was 3,000, and now we have new test strips that are out, and I think as of now it's 4,000 francs. And for the dose of the vaccine, given because we have private clinics and we have public institutes also, but I think for public institute it's actually 3,000 per dose.
Okay.
As for private, I don't actually know, maybe. So I think for private I don't really know, but for public institute it's 3,000 per dose, and you have to take 3 doses as an adult. Okay. That means you have to pay 3,000, you collect, come back again, pay 3,000, 3,000, including the screening for 4,000 francs. So I think roughly that's like about 18,000 francs. Yes, that you spend as an adult to receive the complete dose.
Okay.
Yeah, while for children, like I said, is free.
What's the duration for adults to take this birth dose? Since you said they'll pay 3,000, come back, when are they coming back?
Yeah, for adults, you take the initial dose, you stay for 2 months, you come back and take the second dose, they stay for 3 months and come and take the last.
Okay.
Yeah.
But what was 13,000 as compared to health? If you have seen what hepatitis B have done to some people, you will not imagine.
Absolutely.
So I really like to encourage people to get the birth dose for their children and get the vaccines for themselves if they can or if they are still eligible. Because from what you are saying about screening, it seems somebody can be disqualified, an adult can be disqualified from receiving the vaccine, right? Okay, thank you. Ladies and gentlemen, this is Healthy Living on Dream FM Radio. We're discussing the hepatitis B birth dose with volunteers who are medical practitioners from the community vision group, and they're here to help us understand what the hepatitis B birth dose is all about. Now, I would like you to tell us, are there any misconceptions about the safety or necessities of the hepatitis B birth dose? Are there any misconceptions that you know about?
Okay, thank you very much.
Yeah.
Now, I think that some of the misconceptions that we have to clarify, the very first one is this: the hepatitis B birth dose is not only for children who are born to hepatitis B positive mothers.
Okay.
Because initially we're familiar with the fact that when a child is born, if the mother had hepatitis B, the vaccine is given to the child to protect the child. But now the hepatitis B birth dose vaccine, it's for both mothers who are hepatitis B negative and mothers who are hepatitis B positive. The difference will come in the fact that for a mother who is hepatitis B positive, if she births a child, in addition to the hepatitis B vaccine, immunoglobulin is going to be added to it. So not just the hepatitis B vaccine is given, but every child born, irrespective of the mother, whether positive or negative status, has to receive the vaccine. Secondly, another misconception is that they are newborn, so they are too young to receive a vaccine, and that's not true. Rather, you're going to agree with me that when you are just born, that's why not everybody you don't give your child to everybody to carry.
Yeah.
The immune system of the child is not as strong as that of an adult, so they are more susceptible to infections and all of that. So they getting a vaccine as early as that, protecting their immune system, it helps them a lot. So the hepatitis B vaccine is safe, and your child is not too small to get the vaccine. Lastly, what I'm going to like to mention about is the fact of side effects. Now, generally, like I said, the hepatitis B vaccine is safe, and certain side effects that a child might have might be simple as an inflammation around the area of injection at the time, which can resolve immediately, which are normal side effects that can come with vaccination. But if I have, the bottom line is that the hepatitis B vaccine is safe, and so you should not be scared that your child should take the vaccine.
Thank you very much for that clarification, especially on the misconception. The fact that people used to think that maybe it's only a mother who had hepatitis B, that when she gives birth, her child should take the birth dose. It's for every child, every newborn baby, they should take the birth dose, regardless of the fact that the mother might have the hepatitis B or not. Yes, you want to add something?
Okay, and another thing I want to say is this. You asked Elijah about the hepatitis B birth dose for adults. What adults take is not the birth dose, like the name implies. Birth dose is what is taken at birth. Now, this hepatitis B birth dose is something that is new that we're adding to the calendar. Many of us had not taken it. So now, as an adult, you are not left out. Go get screened. You're going to take your vaccine. Your first vaccine, if you're tested negative, you take the second after 1 month, and the third after 6 months. And now the price is going to vary from one place to another. Yeah. Like Elijah said, that was his experience. I had an experience. My younger sister and I went and got vaccinated, first and second dose. But when we went for the third dose, that was 6 months after, the price had changed to 5,000 francs. So when you go, don't say that they are exploiting it. The prices are going to vary from one place to another, and at different times with cost of production and everything, it's going to vary. So the main thing is to stay safe. Thank you.
Thank you very much for that clarification. We'll come to you, Etienne. Your voice has been, you have been quiet for a while. Well, let's say we have missed your voice. So, I know Hope started talking about side effects of hepatitis B per dose. I would like to come back to you to elaborate on them.
Okay, thank you, Bachanella, for giving me the chance once again. Like Hope rightly said, the hepatitis B vaccine is very safe. It's very safe. Okay. There are a lot of contradictions from people who are just guessing. Actually, scientifically, research has been carried out on the vaccine, the safety has been done, and the efficacy. You know, with the vaccine, before a vaccine is issued out, you also first of all do what is called the efficacy test and the safety test.
Okay.
Yeah, the efficacy test is done on animals, and the safety test is done on humans.
This shows where all of us have not gone to medical. When you say efficacy test, what do you mean?
Sorry, it's the efficacy test is done to ascertain that the vaccine is actually effective against the infection or the virus you are treating, you're giving the vaccine against. So that's what is called the efficacy test. Okay. Then the safety test now is done to be sure that the vaccine does not have side effects that will instead rather kill the person or cause complications that are not needed at the moment. Yeah, so with the hepatitis B vaccine, it all passed the efficacy and the safety test. So when you're going for vaccination, don't be scared. The vaccine is safe, and like Hope rightly said, you know, the vaccine is given, and the way the vaccine works, the vaccine comes to your body, triggers your immune system to develop antibodies against the hepatitis B virus. Okay. So when it enters your system, there's a transition that your body has to recognize that vaccine in your body, develop antibodies against that viral infection, and with that is what sometimes you have a fever, you might have a swelling around the area, you might have some itches sometimes for some people. Okay. And some people even, I remember when I took my vaccine with my classmates, some of them actually stayed home for 3 days. Okay. They felt that they were sick just because of the few side effects, but it was just it doesn't happen to everybody as you may see. But after that, they recover from the first dose. When you're going for the second dose, the side effects does not come again like that, because your body is already developing the antibodies. So there are no side effects for the hepatitis B vaccine.
Okay, you did mention that some of your classmates had small issues when they took the vaccine.
That's right.
Now somebody might be asking, why will I put myself through that? What if I contract hepatitis B? Will not take just 3 days to heal or to clear off? Can you shed more light on how hepatitis B can be on the human system?
Okay, thank you. The hepatitis B virus itself is different from the vaccine, right? With vaccines, the vaccines are some of the vaccines, they are actually attenuated. When I say attenuated, they are half killed. Right, you take the virus, you reduce the strength of it such that it cannot cause the disease. So with that, the strength of the vaccine cannot be compared to the virus itself, and the virulence of the virus too is different from that of the vaccine. So with the vaccine, you can only get a slight side effect, but with the virus itself, it's going to multiply, because it has a tendency to multiply in your system, and it will cause a lot, it will lead to further complications. So the vaccine and the virus cannot even be compared.
Okay, thank you. Elijah, I would just like you to briefly tell us how hepatitis B can look like symptoms in the human body, so that our listeners should really see how dangerous it is and see the importance of getting their vaccines.
Okay, Petronilla, thank you. for hepatitis B, we have we can classify it as acute or chronic hepatitis B. Acute hepatitis B meaning you are infected and the infection is still less than 6 months, and after 6 months we term it chronic hepatitis B. And for some, like we said before, yeah, hepatitis B most of the time is not symptomatic. That means when you get infected, you might not just experience any signs and symptoms. Okay. Therefore, some people, people I know systems are not the same. For some people, they might just have fever, joint pain, headache, yes, fatigue. But most of the time, it wouldn't show. And
okay.
And when it gets into you like a virus, of course, it will multiply. With time, if they don't discover it, maybe you come to the hospital to give blood or do 1 or 2 things, and we find out it stays within your system. It multiplies in your liver precisely. As it multiplies in your liver, the next thing is, by the time it starts showing you signs and symptoms, is when it had already started damaging your liver. So of course, most of the time we say the signs and symptoms it showed you at times is already it's like signs and symptoms of your liver already failing. Mm-hmm. Yes, and like it's not you don't show a specific sign and symptom that this is hepatitis B, but the signs and symptoms that you see will be that of a liver problem, and that showing you that no, there's a problem with this liver. And most of the time, given where we are, that's Africa, Cameroon. So we just want to, when we are screening you for maybe when you come with a possible liver problem, when we are screening you, we always involve hepatitis B there. And at that, hepatitis B will be one of the most common cause of liver problems. And at that stage, where the patient already have liver malfunction, patients start presenting with yellowish coloration of the skin. That's what we call jaundice. The patient might have a distended abdomen. The patient might feel pain on the right or upper quadrant of the abdomen. That's just on your right abdomen, just below your rib. The patient might also, at some stages, like at the end stage, start having swollen legs. And all those now, they are signs of liver failure actually, not like a specific sign of hepatitis B. So if someone is around and the person is walking and you feel like you have yellowish coloration of the skin, you always feel this pain, like a dull pain on your abdomen, and or you have sudden abdominal distension, I think you want to come to the hospital for checkup.
Wow, thank you, Elijah, dear listener. If you are listening, I hope you have heard it from medical practitioners, not talking about you that hear you. You have heard it from medical practitioners how harmful hepatitis B can be to you. It's easy for you to get a hepatitis B dose vaccine to protect yourself from this hepatitis B virus. Now, Etienne will come back to you to know how this community outreach can help increase awareness of the importance of hepatitis B birth dose.
Thank you again, dear listeners, for being with us. We appreciate the fact that you're there listening to us. With the outreach programs, I would say it's the best way so far to create awareness, to let our listeners know that this hepatitis B that we're talking about, it's actually so serious, more than we even think. I know there are a lot of people now, even today, that they still don't know anything about hepatitis B. Yeah. When you go to some villages, you see people still exchanging their needles. They're exchanging people exchanging their dresses, even the fields. They feel like they just neglect. They feel like it's nothing.
It's not even only in the villages. If you go to Bamenda, these are hot girls who call slay queens. This one will go and carry this one's dress, and when they will struggle, keep money, buy one dress, and all of them will use it for their programs. Today is this one's turn, tomorrow is that one turn.
Exactly.
And we're seeing that it's contaminated through, is transmitted through contaminated body fluids, right?
Yes.
Okay.
So thank you for that fact. And actually, we are saying that there's a lot to be done about hepatitis. And our community vision group, I want to say, community vision group is doing a lot. They have been going to schools and educating the schools about hepatitis B. They have been going to churches. They have been going to churches and educating them about hepatitis B. And they have also been offering free screening. They have actually organized a series of free screening to the community. And I'm sure very soon they will be doing and they'll be organizing another one. We just want to tell our listener that when you hear the information, when you hear this news, please let your neighbor knows about it. Tell somebody to tell somebody about hepatitis, because awareness, creating awareness is key to fighting this dangerous disease in our communities.
Thank you very much. I like the fact that you have said somebody should tell somebody. But when you are telling somebody, make sure you are telling them the right information. And you can always get the right information by tuning in to Dream FM Radio every Wednesday. Always have health talks, and on these health talks, you'll pick in very healthy information. And maybe after every 1 or 2 weeks, we will have community vision group members here telling us about hepatitis B. So if you are telling somebody and your information is not right, or you are doubting something, wait for another edition of this program to make sure you get the right information so that you will not misinform your loved ones. Now, Hope, we are rounding up this edition of the program. I don't know if you have any last words, some things you want to add to what we have really discussed before we leave the studio.
Thank you very much once more, Petronila, for the opportunity. And if I'm to reiterate, our main concern here is about the hepatitis B birth dose vaccine. We want us to be aware and do the right thing. And if there's one thing I want to leave you, dear listeners, with this afternoon, it is the fact that you don't want to give birth to a child and educate that child, feed that child, and at the age of, let's say, 20-something, when his or her life is supposed to start blooming, he should be buying a wrapper and a car and all the rest, is in bed because of the complications of hepatitis B vaccine. Because of the complications of hepatitis B infection. Mm-hmm. Yes, so ensure that your children take the hepatitis B birth dose when they are born so that they can be protected from the hepatitis B infection, be protected from long-term complications like liver cancer and liver cirrhosis, and that is a way of protecting our future generations.
Thank you very much, Hope, who have really been assisted very much by Gwen Telma. She has been in the studio with us, giving us a lot of moral assistance, a lot of moral boosting. Thank you very much, Noelle Telma. Elijah will come back to you for last words of this program.
Okay, thank you, dear listener, for being with us throughout the program. And I'll just leave you with this, just like my professor used to say. The best treatment actually is prevention.
Okay.
Yes, the best treatment ever is prevention. Okay. And like we are talking about the hepatitis B virus and the hepatitis B infection. So, and we have made mention that, of course, you can prevent it with vaccination, starting with the bed dose. That is what we are really emphasizing on. And of course, like I said again, the best treatment is prevention. So why not prevent your child? I'm saying this particularly to mothers. When you give birth, even if the institute, they don't tell you that, Mama, we have to give this child the hepatitis B bed dose. You should remind them that, no, I heard something over the radio about the hepatitis B bed dose, which is the hepatitis B vaccine given at birth. You should remind them that you want your child to take it. Thank you.
Very, very important. Prevention is better than cure. That's what I did. It's your last words and we leave the studio.
Thank you once again. I want to say that I would just like to leave our listeners with these 4 phrases. I would like to say, love your liver, get tested, get vaccinated, and protect your liver for a brighter future.
Love your livers, dear listeners. Thank you for tuning to Dream FM this afternoon precisely on health living. Today we'll discuss the vital work being done by the Community Vision Group on the Hepatitis B birth dose advocacy project. It's clear that ensuring newborns receive this vaccine is not just a public health measure, but a commitment to safeguarding the health of our future generations. As we have heard, Community involvement is key, and each one of us can play a role in raising awareness and supporting families in our neighborhood. Let's work together to create a healthier Bamenda. Until next time, stay informed and take care of your health. Have been in the studio for have been with Elijah Akwanga, have been with Yisa Etienchia, have been with Ngweli Telma, and for presentation have been no other person than Bamenjo Petronila. Stay tuned, we'll have the PG News right away.